Hello, my name is Chad Atwood, and I'm going to speak to you today about my practicum experience with Kent County Health Department in the Division of Emergency Preparedness. Kent County Health Department is located in Grand Rapids, Michigan. It's on 700 Fuller Avenue on the northeast side. So, emergency preparedness, it's an emerging issue within public health. It, The responsibilities of emergency preparedness involve planning and coordination during an event, whether it be planned or unplanned. It's a continuous cycle of planning, organizing, training, equipping, exercising, evaluating, and taking corrective action in an effort to ensure effective coordination during an incident. Um, the Emergency Preparedness Division within Kent County is two people, Carla Black, who is the Emergency Preparedness Coordinator, and then Pat Draper, who is the Emergency Preparedness Specialist. So my responsibilities during my practicum with Kent County Health Department was a lot of different meetings. I was a part of the Disaster Mental Health and Human Services Committee, Region 6 Healthcare Provider Coalition, Region 6 Community Health Work Committee, and then the local emergency planning committee, as well as a quality improvement work group. And then finally, my largest responsibility, a part of this practicum, which will involve the products that I created, were the Centers for Disease Control Strategic National Stockpile Medical Countermeasures Annex and Appendix. So during this practicum experience, there were a couple of competencies that I focused on the most. Number 9 was designing a population-based policy program, project, or intervention, in which I helped coordinate and do a distribution node exercise, and then also recreated and edited an distribution node appendix, which is in the Kent County Health Department Emergency Operations Plan. And then also another competency was number 7, which is to assess population needs, assets, capacities that affect the health of a specific community served. And with this, this was met by all those various coalition meetings that I was a part of. And then also during that, we established some push partners, which I'll discuss later on in this presentation what that is. So going on about that long term I just mentioned, the Strategic National Stockpile is a large part of the Emergency Preparedness Division. The Strategic National Stockpile is comprised of medical countermeasures that are readily available to be dispersed anywhere in the United States within 12 hours. Medical countermeasures are products that may be used in an event of a potential public health emergency. These could be used in an event such as a terrorist attack with a biological, chemical, or even radiological or nuclear material. It could be a natural disaster or maybe like an emerging disease, an epidemic, or a pandemic. Medical countermeasures can be used to diagnose, prevent, protect, or treat these different conditions. Medical countermeasures include vaccines, antibiotics, chemical antidotes, antitoxins, antivirals, personal protective equipment, respirators, and many other medical equipment as well. It's been said that the Strategic National Stockpile has become one of the most important initiatives in mass casualty disaster response. The medical countermeasures in the Strategic National Stockpile was created back in 1999, but it became a very larger aspect after the events of 9/11 in 2001. The medical countermeasures have been utilized in the United States for many different responses over the years. The Strategic National Stockpile has been deployed for the H1N1 flu pandemic, flooding, major hurricanes. There was a botulism outbreak, Ebola, and also the Zika virus. Every state has a plan to receive and distribute these packages quickly, and One thing though is that local jurisdictions differ as far as logistics and how the disbursement is to go about. Within the United States, the Strategic National Stockpile has only been deployed once, and that was in 2009. It was not a 12-hour push package as they define it, but more or less it was medical countermeasures that were dispersed in the event of the H1N1 influenza pandemic. The state of Michigan received the assets, which included anti-influenza or flu medication, some medical supplies, and then also some personal protective equipment. The assets are distributed to every county in Michigan, and then from there it goes to the county, and then from the county level it's dispersed to the public through a distribution node and also points of distribution. So going on to the next slide here, this is the flow of medical countermeasures. So from the CDC, they distribute the Strategic National Stockpile. It then goes to the state in which they receive it, and then it is dispersed from the state level to the county level. So every county will have a distribution node, and this is where they will receive the assets. From the node, they will distribute it to points of distribution, and at these pods, as they're also called, from there it can be dispersed to the public as it would be. So going on about the background of the population that was assessed, Kent County, Michigan has a total population of 640,000 people. It contains the city of Grand Rapids, which is the second largest city in Michigan. And then within Kent County Health Department, there's the Division of Emergency Preparedness. Kent County, like any other county in the United States, is at risk of many different threats, including chemical, biological, radiological, and nuclear. Protecting the population is crucial, and a large aspect in the Department of Emergency Preparedness is planning for the worst and making policies and plans to work for the best, given any situation. Kent County Health Department is a FAB accredited health department. This is the Public Health Accreditation Board. They have been accredited since 2014. Part of meeting this accreditation is having very strong plans in the event of emergencies, and then also meeting some state and federal guidelines. The health department must meet the Medical Countermeasures Operational Readiness Review. The review was a requirement made in the CDC in 2014. This is a required program for health departments to compare their medical countermeasure plans and activities to national standards to measure the department's ability to respond in the event that we need medical countermeasures. It's very similar to the accreditation process that the health department goes through with FAB. However, there are some differences that do exist. Kent County Health Department also has a number of different facilities. Its main location is at 700 Fuller Avenue in Grand Rapids. And then they also have 3 different clinics within Kent County. There's one in Kentwood, Rockford, and then finally the one that's in Grand Rapids. If there were to be an occurrence that required medical countermeasures to be distributed to Kent County, these clinics would be used as the points of distribution, or the pods. The Fuller campus would be the main hub or the distribution node where the assets would be received and distributed from. So as I've been talking about the Strategic National Stockpile, you can see that my main product was going to be focused on that. So during my meetings with my supervisor, Carla Black, who's the Emergency Preparedness Coordinator, we determined some gaps for improvement within the Medical Countermeasures Annex, a part of the Emergency Operations Plan for Kent County Health Department. So meeting with her, I reviewed the Medical Countermeasures Operational Readiness Review and the FAB requirements for this. And we determined that we need to simplify the process and also train some staff to be better equipped for an event that we need medical countermeasures. A lot of this focus was on the distribution node. And so going forward, we reviewed the medical countermeasures operational readiness review requirements. One of the main requirements was under Capability 9, which is under medical material management, which relates directly to a distribution node under those requirements. So function 1 was to direct and activate medical material management and distribution. So a part of that, we determined a need to train the staff by doing an exercise of a distribution node. So we met with Pat Draper, and she is the emergency preparedness specialist. She has been employed with Kent County Health Department for a number of years, and so she was actually involved in the 2009 H1N1 pandemic. So she had a lot of knowledge on what happened when they received those assets, and we asked her, how the flow was, where the material went, if she remembered any pieces of that needed to be worked on as well. So during that as well, during this meeting between the three of us, we also determined what we would need to do a drill. And so we gathered what we would need for materials, all the necessary forms involved in a distribution node, and then figuring out how many staff would be attending this, how many staff we would need for a distribution node, and just figuring out all the logistics of the exercise itself. A part of some more research that I did to better understand the distribution node and the flow of one, I took various FEMA courses. FEMA is the Federal Emergency Management Authority. They have many courses that go over a lot of incident command and management systems. And then also I reviewed the current distribution node guidelines for Kent County. I reviewed the job action guides for each of the roles that are in the distribution node, and it was determined that these were very lengthy. They had a lot of verbiage in them that weren't needed, and they needed some updating. And then also, along with these job action guides, or JAGs as we also called them, since some of the roles were deemed not necessary, we also did an incident command system remapping. So the chain of command that's involved with the distribution node, since some of these jobs were not specifically necessary for Kent County, we eliminated some and then reworked how the chain of command would work. And then also a part of this, I did some comparison with some other distribution node plans from other counties just to see if ours was on track or if there could be any improvements done. So the results of all of this planning research exercise was we did do a distribution node exercise. This was completed back in March. And then also I updated the distribution node appendix, which is now in the Kent County Health Department Emergency Operations Plan. So this is the front page of it right here. But moving on to the next slide, I'll kind of play a video for you, hopefully. Here we go. So let me pause it. Oops. Let me go back. So this plan right here that's going to start playing, this is everything I updated. So it has a table of contents here that goes over everything that's involved in the distribution node, starting off with an introduction, what happens during the activation plan. You will see here that some of these are blacked out. This is just for confidentiality. There's phone numbers and some sensitive material listed here. So it starts off with an introduction of what the node is, how it functions. Basically, how am I trying to phrase this? This plan is made so that anyone could pick it up and they would be able to activate and manage a distribution node. So before this happened, this plan was very lengthy. It had a lot of material that was not necessary in order to activate a distribution node, and we just want to make it very simple so that way it's understood how it functions, how it works, what needs to be done, so that it literally anyone within the health department could do it in the case of emergency. So moving on through this here, it has everything from temperature control, inventory management, command and control. There's a slide of the incident command structure, how it would be staffed, communications, security, and then also transportation. I included some maps in here of from the node how to get to the points of distribution, and then also how to deactivate the node. So when everything's said and done, how it can be finished. Right here is a check. Oh, I keep going back here. Sorry. Let me fast forward. So right down here, this checklist is required by the state, and basically it's just that we meet all of the criteria of 700 Fuller to be a distribution node. So it just goes over things such as square footage and if there's adequate locks on the building and just a lot of different things. It's not, from a activation standpoint, it's not necessary for that, but it has to be included in the plan to meet the certain requirements of both the state, the operational readiness review, and then also some fab requirements too. So moving on from here, also included in this are all the job action guides, or the JAGs. So these go over immediate attention, what needs to be done right away, and then the ongoing attention, which is the continued job tasks. So there are quite a few different ones on here, so that's why I'm scrolling kind of quickly. Everything from the distribution node manager to the shipping and receiving clerks. And then finally you'll see there's a distribution node map of how it would flow through the county node, where we receive the products, where we distribute them, and everything in between from quality control. So then also near the end of the video there, I went kind of quickly, I apologize, there were just a couple more attachments to be added to it, and that would be where all the forms will go. There's going to be hyperlinked forms within the document at Kent County Health Department, and then also there's one other attachment that has all the contact information, which I can't include on this slide anyway, which has all of the environmental health staff, the emergency preparedness staff, and then other key contacts that would be needed. So my recommendations for this product, now that Kent County is using it, is I think it can be a guide for other health departments to use in their emergency plans for medical countermeasures. It is streamlined and slimmed down and just directly has all the information you need to activate, run, and also deactivate the node. A part of this is, since we met the requirements for the Public Health Accreditation Board, it also can be a guiding principle for health departments who are seeking accreditation, and it can kind of show them what really needs to be in their documentation in order to meet the different guidelines and capabilities that are involved with that. And then finally, it isn't included in the product that I showed you, but a part of our exercise with the distribution node was each staff member who participated, they were given a job action guide pamphlet. So this pamphlet included the map that you saw, and then everything that was listed on those job action guides that were in the document were slimmed down into a pamphlet form. So that way it's just a lot quicker. We can hand them out to staff and say, hey, you're going to be the distribution node manager, or you're going to be a picker or a sorter, or you're going to do quality control on these products. So when they're handed a JAG, it is just a simplified pamphlet form that gives them all the necessary chain of command, and then also all the tasks that they are responsible for. So in conclusion, you can see that emergency preparedness is necessary everywhere. You can never be too prepared for a situation. The Strategic National Stockpile medical countermeasures involve many resources, and having a good plan in place will save more lives and just make the health department work a lot easier. During this practicum, I was able to assess population needs and then help to design a plan in that exercise to help address the population, address helping the population in the event of medical countermeasure needs. Thank you for your time. If you have any questions, you can definitely shoot me an email, either through Western Michigan or through Gmail. And then also here are a list of references that I used in this slide. There is a number more references that I have in the paper that I wrote for this assignment. Thank you.